there. When there's something that's not working, I tell the people it's not working. This is the government, and I could walk into any government.
New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Before I start the formal portion of my speech, I just wanted to say something that if someone needs immediate care, it's still safe to go to an emergency room department. Our hospitals have taken precautions to keep people suspected of having COVID-19 outside the emergency rooms by setting up off-site assessment sites or in other parts of the hospital. So I don't want anybody to stay away from the emergency department if they absolutely need to go. Avant de commencer la partie formelle de mon discours, je tiens juste à dire que si quelqu'un a besoin de soins immédiats, il est toujours sûr de se rendre à un service d'urgence. Nos hôpitaux ont pris des précautions pour garder les personnes qui pourraient avoir le COVID-19 en dehors des salles d'urgence en mettant en place des sites d'évaluation hors site ou dans d'autres secteurs de l'hôpital. Good afternoon, everyone. Je sens à quel point les citoyens du Nouveau-Brunswick sont emballés par la possibilité de pouvoir bientôt revenir à la normale. Tout le monde veut savoir quand nous pourrons recommencer à vivre comme avant, c'est-à-dire quand nous pourrons, sans y penser deux fois, faire du lèche-vitrine dans les magasins, rendre visite à un parent âgé ou prendre un café avec un ami. Je vous promets que la vie reprendra bientôt son cours normal, mais ça ne serait pas un normal comme nous le sachons maintenant. Nous ne sommes cependant pas encore arrivés à ce point et beaucoup s'imaginent à quoi ressemblera notre vie le mois prochain, cet été ou cet automne. Il y a du monde qui me demande toujours quand est-ce qu'on saura. Mais toutefois, un bon nombre de Néo-Brunswickois n'ont pas le luxe de réfléchir si loin dans l'avenir. Ils ne peuvent penser qu'à la prochaine journée, qu'au prochain quart de travail ou qu'au prochain client ou patient. Je parle évidemment de nos travailleurs de la santé de première ligne. Mais je ne parle pas seulement des médecins et des infirmières, bien qu'ils accomplissent un travail essentiel dans le cadre de cette pandémie. I sense how excited New Brunswickers are at the prospect of getting back to normal, and everyone wants to know when things will go back to the way they were, when you can go browse in a store casually, visit an elderly relative, or just have a coffee with a friend without giving it a second thought. And I promise you that normal or something like normal is coming. What version of normal that would be, I can't say. And we're not there yet. But while the rest of us imagine how things will be next month or in the summer or the fall, there are many New Brunswickers who do not have the luxury of thinking that far into the future. All they can think of is the next day, the next shift, the next patient, or the next client. And I'm talking about our frontline healthcare workers, not just doctors and nurses, although what they are doing is very vital for the pandemic. I'm talking about those who work in our communities through the extramural program, nursing homes, special care homes, and community residences, as well as those providing home support and attendant care to seniors and to adults with disabilities. The work you are doing is noticed, and we thank you for all that you do and will be asked to do as we tackle this emergency together. Today, there is one new case of COVID-19 to report, and this brings the total number of cases to date to 117. And this new case is in Zone 5 in the Camelton region, and the individual is aged 40 to 49. Aujourd'hui, il y a un nouveau cas de COVID-19 à signaler, ce qui porte le nombre total de cas à 117. Le nouveau cas est situé dans la Zone 5, la région de Camelton. Il s'agit d'une personne âgée entre 40 et 49 ans. It's encouraging to see this slow growth in the number of confirmed cases, and it's only natural to wonder if this indicates an end to the outbreak. I am much more concerned about community transmission right now as opposed to the travel-related cases. And so with the expansion of the testing, and I do encourage everybody who can get tested to call 811, call your family doctor or your nurse practitioner to get an appointment, to get a referral, to get tested. Because we do know that some people can have very, very mild symptoms, and we really want to know, again, what the extent, to what extent community transmission is occurring. It is human nature to speculate about when and how we will return to normal and what that normal will look like. But we must not get ahead of ourselves. We must continue to do all that we can to slow the spread of the COVID-19 virus and deny it the opportunity to entrench itself in our province. And this is a real danger. I don't think as long as our neighboring provinces and our partners down in the south have more virus circulating than we do at the moment in terms of their actual numbers, I don't think we can rest easy. I think we still have to be vigilant. Again, with community transmission being the bigger risk right now, that is what we really, really need to be cautious of, and that's why everybody needs to keep doing what they're currently doing. So that means continuing to stay home as much as possible, keeping your interactions brief when you must go out, washing your hands thoroughly and regularly. All of these things are so very, very, very important. And I don't want people to lose sight of that. You maintain that physical distance of 2 meters between yourself and others, and just keep doing what you're doing. And, you know, I'm thanking a lot of people here today, but I also want to thank the people who are watching who are staying home. Thank you as well. It is very difficult for some of you, especially if you have young kids or there's other issues around how difficult it is for people to stay home, and everybody's situation is different, so I want to thank you as well. Vous pouvez contribuer à l'effort en continuant de rester à la maison autant que possible et de garder vos interactions brèves quand vous devez sortir. Vous pouvez continuer de vous laver les mains fréquemment et soigneusement. Vous pouvez continuer de maintenir une distance physique d'au moins 2 mètres entre vous et les autres. Vous n'avez qu'à continuer de faire ce que vous faites présentement. There are people in our communities who are working hard in the face of the outbreak, and those people, their work carries many of the same risks faced by those in the hospital setting, in the sense that community workers are caring for our most vulnerable citizens, the elderly, the disabled, and those with special needs, and they must keep themselves and the people they work with safe from this disease. The extramural program is also providing a vital service in our communities, and by enabling people to receive care at home, the EMP program is helping to reduce hospital admissions so that staff there can focus on the epidemic. Please be assured that if you need care through the extramural program, you will get it. And EMP is taking steps to reduce the risk of spreading the virus through its work by providing care remotely where possible and screening patients to determine the potential risks of COVID-19. As with any other healthcare setting, it is very important that you be truthful with the extramural staff with any symptoms you may be experiencing, because they need to be ready if there is a COVID-19 patient, if you have symptoms, if it's potentially present in your home, they need to have the appropriate protective equipment on when they visit. So all of our community healthcare workers are doing courageous work. They deserve our commendation and our support. They are every bit as heroic as the work that their peers are doing, such as doctors, nurses, paramedics, and laboratory technologists who work in more traditional settings. Le personnel du programme extramural prend des mesures pour réduire le risque de propagation du virus dans l'exercice de ses tâches en fournissant des soins à distance dans la mesure du possible et en effectuant des vérifications auprès des patients pour déterminer s'ils sont à risque d'avoir contracté le COVID-19. Comme c'est le cas pour tous les milieux de soins de la santé, il est très important que vous soyez honnête et que vous faisiez part de tous symptômes que vous avez aux membres du personnel du programme extramural. Ils doivent être prêts à la présence possible de la COVID-19 dans votre maison et porter l'équipement approprié lorsque vous rendez visite. Tous les travailleurs de la santé en milieu communautaire s'acquittent courageusement de leurs tâches et méritent nos éloges et notre soutien. Ils effectuent un travail tout aussi héroïque que celui qu'effectuent les médecins, les infirmières, les travailleurs paramédicaux et les technologues de laboratoire dans les milieux plus traditionnels. Our gratitude to all these heroes is boundless. We can best repay them by making their jobs a little bit easier by continuing in our efforts to reduce the spread of this virus. If we all continue to do this, we will in time be able to get back to somewhat relatively normal lives compared to before, but we really need to do this together. And only in time will we be able to know exactly what that looks like, but in the meantime, again, we all have to work together. Thank you very much.
Good afternoon. Bonjour. Throughout this time, I've been increasingly impressed with how everyone has stepped up to meet the unique challenges associated with COVID-19, including New Brunswick businesses. In normal times, it is unusual to see a line of people outside the stores in our province. Notre première réaction, c'est de penser que le magasin est bondé s'il y a une file à s'attendre pour y entrer. Dans la réalité d'aujourd'hui, c'est le contraire qui est vrai. The lineup you see outside, with patrons patiently waiting a proper physical distance apart, generally means the store is ensuring that those who are shopping have plenty of space to do so. Some stores have arrows on the floor to keep people moving through the store in the same direction. Others make regular announcements to remind people of the importance of physical distancing. Plusieurs commerces offrent un service de courriette ou de livraison à domicile pour que les gens puissent éviter d'entrer au magasin. Certains restaurants qui avaient fermé initialement rouvrent maintenant afin d'offrir des repas à emporter et à livrer. Some stores that have had closed are now offering virtual tours of their location and curbside pickup so people can purchase the items they need. Business owners across the province are finding ways to keep their customers and staff safe, while enabling them to continue to operate. It is this creativity combined with our caring for one another that will get us through this difficult time. We must be innovative. We must think each day how we can just operate a little safer. I encourage you to support these businesses, to be patient when you have to go to a lineup or to get inside, to thank the staff for their hard work and their continued dedication. N'oubliez pas qu'ils sont inquiets pour leur propre sécurité, ainsi que pour la sécurité de leurs êtres chers, et pourtant, ils sont là jour après jour pour veiller à ce que vous puissiez acheter les actes dont vous avez besoin. New Brunswick businesses aren't just helping on a local level. Some are making a difference on a national level as well. For example, BioOriginal, a division of New Brunswick's Cook family of companies, has been approved to produce 3 different kinds of sanitizing products, including hand, surface, and workplace sanitizers. BioOriginal collabore de près avec la Université de Saskatchewan pour développer le produit désinfectant qui sera disponible sous le nom Biotide. It certainly isn't business as usual, but I applaud everyone who's doing their part, often going above and beyond to make this work. It hasn't been business as usual with government either. The House leaders of the 4 parties in the Legislative Assembly have been in discussions and have decided that the House will reconvene on Friday at 11 a.m. for 1 day. Legislative amendments will be introduced to provide job protection for workers who must take a leave of absence due to COVID-19. Le but est de protéger les emplois des gens de Nouveau-Brunswick qui ont la COVID-19, en qui ne peuvent se présenter au travail parce qu'ils soignent quelqu'un atteint du virus. We will also be introducing amendments to the Emergency Measures Act. The original intention was to allow for an increase in fines relative to social distancing violations. However, the recent case numbers would indicate this may be unnecessary. We will discuss this together in tonight's COVID Cabinet meeting. These amendments are also intended to expand the statute of limitations for courts and tribunals and to expand their statutory deadline where required by 90 days after the emergency order is over. Since the closure of the child care facilities, the Department of Education and Early Childhood Development has received nearly 3,000 requests for emergency child care and has closed 2,496 cases, including placing more than 1,000 children in emergency early learning and childcare facilities. Despite tremendous efforts from our early learning educators and staff, some communities still face challenges in establishing emergency childhood facilities. That is why government has proposed legislative amendments to the Emergency Measures Act that will enable the Department of Education and Early Childhood Development to establish emergency childcare facilities in New Brunswick. This allows for the department to draw on its resources, such as school facilities, to ensure our frontline emergency workers have the child care they require to continue to provide essential services. Les bouts de tout ce que nous faisons, y compris le projet de loi qui seront présentés vendredi, et de protéger les gens de New Brunswick. As decisions are made and new information becomes available, we will continue to keep you informed. As you may remember yesterday, I was asked by a journalist about the possibility of temporary pay raises for employees at long-term care facilities, and a program announced just earlier hours before by the Prime Minister. I want to be clear. At no time did I say I wasn't interested, as the ensuing headline suggested. The federal government has announced a program that will supplement the salaries of essential workers who earn less than $2,500 a month. We have not received a lot of detail on how this program would work or how many, if any, New Brunswick workers will qualify. For example, in our nursing homes, our full-time employees earn much more than this threshold. We are aware that some provinces, due to inequities between private and public nursing home workers, have decided to implement this measure. In addition to healthcare workers, we have a number of essential workers who are involved in the fight against COVID-19. We believe that our frontline workers deserve all the support they can get. We need more details on this program before making any decisions. However, I am most interested in any federal funding that could be available to these essential workers. I look forward to speaking with the other premiers as well as the Prime Minister and the Deputy Prime Minister to learn more about this program. We have been so fortunate that in New Brunswick, our dedicated special home workers, our home support workers, and our personal support workers have shown unparalleled dedication to their jobs and to our seniors. They are providing valuable continued service. Our positive results in terms of COVID cases being lower than other jurisdictions in these critical areas are directly related to the quality of care and the dedication of the individuals that are protecting our seniors. Though New Brunswick has been doing well overall at slowing the spread of this virus, we must continue to be vigilant. On the flood side, the water levels rose between Fredericton and Gagetown today, but if things go as forecasted, they should start to go down in the coming days. Nous savons que les gens seront tentés d'aller jeter un coup d'œil au cours d'eau pour voir la hauteur des niveaux d'eau. Le tourisme d'inondation n'est jamais une bonne idée. C'est particulièrement vrai alors que nous travaillons à ralentir la propagation de la COVID-19. I ask that you continue to obey the directives of public health. Together, we will not only get through this, but we will find ourselves opening up to get a more normal way of life sooner, not later. Thank you very much. Merci.
Merci, Monsieur le Premier ministre et Dr. Jennifer Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Thank you, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. Each reporter will have one question, and you will have the right to pose your question in the language of your choice. Clara Pasieka, Times and Transcript.
Hello, this question is for the Premier, though perhaps you can ask Dr. Russell to elaborate if you can't answer fulsomely. Premier, disability advocates here in New Brunswick have heard about draft directives in Ontario relating to persons with physical or intellectual disabilities, indicating they may be deprioritized from receiving treatment if they contract the virus. Will the province of New Brunswick be exploring similar deprioritizing directives, or will New Brunswickers with disabilities receive full treatment if they contract the virus?
I am surprised that's even a question. I mean, certainly, any individual, any individual, any citizen of this province, regardless of any disability, will receive the same level of care in all cases.
Thank you. Claire, do you have a follow-up question?
Can Dr. Russell expand on anything that's being done to communicate these types of messages to those with disabilities?
I had read the same information about, I forget which province it was, but we have not been having any types of discussions like that here in New Brunswick.
Thank you.
Thank you.
Elizabeth Fraser, CBC.
So my question is for the Premier. The Federal Minister of Economic Development, Melanie Joly, has suggested New Brunswick isn't doing as much as other provinces to help small and medium-sized businesses. She's been talking to business groups in the province that are seeking help with rent and salaries. What do you say to that?
Well, I would ask, I guess, if the minister's been talking to our CEO of Opportunities New Brunswick, who has collected at this point in the order of 1,400 direct requests from businesses and is coordinating that. That is a central program called Navigators. This individual, our CEO, is coordinating that and has a webinar every week and connecting the dots between businesses and the federal counterparts, and then working to ensure that they actually receive action. So I don't know if the minister's talked directly with our CEO or with our minister in small business and in economic affairs, but I certainly would encourage that. And if the minister would like to connect with me personally, I would be more than happy to learn of any particular cases.
Thank you. Elizabeth, do you have a follow-up?
Yes, I have another question for Dr. Russell. Dr. Russell, from your opening statement, it sounds as if you think perhaps people who have some symptoms and should be tested are not actually getting tested. Is that your suspicion, and why?
Well, my opening statement was around people not going to the emergency department who should go to the emergency department for things that they routinely would go to the emergency department for, so chest pain, etc. So those were my opening comments. It was around, I think people have been a bit afraid to go to the emergency department because they are afraid of people being there who have COVID-19. So my points were really around how COVID-19, potential COVID-19 patients are assessed and where they're situated so that people don't have to be afraid to go to the emergency department.
Thank you. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. There have been an abnormally high number of deaths in the last few weeks at Fundy Nursing Home, which is a small nursing home in Blacks Harbour. I counted 6 names alone from that home who've had their funeral arrangements at St. George Funeral Home. Are you planning to investigate nursing homes with abnormally high death rates for possible COVID-19 infections? And will you look specifically into why there have been so many deaths recently at Fundy Nursing Home?
Well, certainly I'm not aware of that situation at the Fundy Nursing Home at all, and I'm not aware of any particular issues around other nursing homes in relation to COVID-19. But given your question, we will certainly investigate and understand I guess the reality of this case and if it's related at all to any particular COVID-19 issue.
Thank you. Vicky, do you have a follow-up?
Yes, thank you. It's also for the Premier. I called the funeral home in St. George that is taking care of funerals for residents of Fundy Nursing Home in the past few weeks, and they said, well, they're not necessarily given specifics about the cause of death. Inability to thrive is often cited as a more general cause, which could mean it's related to loneliness and maybe just giving up. Do you know if deaths in nursing homes are significantly higher than usual across the province? And don't all of these deaths warrant investigating for cause, even if it's just that people are giving up?
You want to speak to
I don't have any knowledge around any increased numbers of deaths, but I do know that if there is a suspicion that a death is related to COVID-19, there is a way to test for that. And any of the situations that I have heard about where somebody was suspicious that a death could have been related to COVID-19 and they were tested, the tests came back negative.
Thank you. Andrew Waugh, Telegraph-Journal.
Hi. I'm not sure really who this question is for. I sent a request yesterday asking for specific numbers on how many test kits New Brunswick currently has. So maybe somebody could give me an update with a number on that, please.
We have plenty of test kits to handle any of the number of tests that we're looking to perform or need to perform. And certainly, as Dr. Russell opened up the testing strategy here earlier in the week, and as that expands, we're adequately supplied to meet those demands. So I think that, rather than get into, the number of test kits that we have and doing that inventory count every day, I want to be in a position that we can report that we have adequate supplies, and supplies are not restricting our ability to provide maximum health care and testing that we need to do as it's decided to be done.
Andrew, do you have a follow-up?
Yes, I do. Thanks, Bruce. Again, to the Premier. Premier, two Liberal MLAs, Andrew Harvey and Roger Melanson, have just issued a press release calling for a blueprint for an economic recovery in New Brunswick. Do we have a blueprint on how this is going to work, or is this situation just still unfolding?
Well, it's interesting. We've been talking about that over the last couple of sessions about, while ensuring that our healthcare focus remains, we need to also add our focus on economic recovery. It has been a topic in the discussion with the COVID cabinet, and in fact, it's on the agenda tonight in tonight's meeting as well. So I'm hopeful that both Mr. Harvey and Mr. Melanson will have that discussion with their leader, Mr. Vickers, and we will have a fulsome discussion in our meeting. I think that we're building this together. When I mentioned about the 1,200 businesses or 1,400 businesses that have connected, we're looking at how do we categorize them, which ones can start up quicker, working with public health, what areas can we make changes, how can they meet the public guidelines and health guidelines and make that work. But I think more importantly, too, or as importantly, is that, we have been working very well together as different political parties and having great discussions about next steps. And this is certainly the next step. And I am hopeful that the committee, the COVID Cabinet Committee that we have working to date will be able to continue in the fashion that it has been continuing, because, the results of us focusing on the task at hand versus, being in our individual corners trying to pick away at each other, it really makes a difference. And it really is the best interest of all citizens in our province. And at this point in time, there's never been more value in political parties coming together with a common focus.
Thank you, Premier. Thank you, Andrew. Matthew Boiscomo, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre. L'Assemblée législative va reprendre ses travaux temporairement vendredi. J'aimerais savoir s'il va y avoir une période de questions et des déclarations de députés. Le Parti vert, notamment, demande ça.
So that is another item that's on the agenda tonight with the COVID Cabinet Committee is, should we have a full assembly or not? Well, it won't be full. They're going to be restricted numbers. So a lot of people will not be there. And what is the pros and cons of doing that? I know that any questions that are required to be asked, as I mentioned before about the cabinet, our COVID Cabinet Committee, they're very openly asked on our discussions and our meeting, which is tonight. So there's nothing being held back. There's nothing being any questions asked. There's answers being given, and we do research as required if we don't have the answers. And there's great ideas being brought forward by all members of our team. So we'll have that discussion. I mean, if there's a reason to do that, and the general consensus is we'd like to do that, then that's fine. We'll do it. What the benefit will be, I guess, would be determined and if it goes forward. But it'll be just agreed or decided tonight with our cabinet, COVID Cabinet Committee.
M. Wakomo, as-tu un suivi?
Oui, merci. Cette question-ci est pour Dr. Russell. Vous avez parlé d'un retour à une certaine normale à un moment donné. Pouvez-vous nous peut-être nous donner un aperçu ou parler un peu plus de qu'est-ce que pourrait avoir l'air cette certaine normale qui ne sera pas un retour à la normale comme on l'avait avant, mais qui pourrait peut-être être différent de la situation actuelle?
Alors, avant qu'on aura un vaccin 18 ou 24 mois d'ici, je ne crois pas qu'on va voir un vrai normal. Et même après ça, c'est possible que ça ne sera pas plus jamais un vrai normal. Alors, c'est-à-dire que d'ici à ce temps-là, quelle sorte de version, quelle sorte de normal on va voir, ça dépend de les nombres de cas, ça dépend les hospitalisations, les admissions des soins intensifs. Ça dépend le mode de transmission et le nombre de cas en total qu'on a et aussi ce qui arrive avec nos voisins. Alors, il y a plusieurs choses qu'il va falloir considérer quand on fait des décisions comme ça. Et comme je vous avais dit hier, je crois que on est encore à au moins 14 jours après le fin de semaine qui vient juste de passer pour voir qu'est-ce qu'on va voir comme résultat de la distanciation physique. Est-ce que ça continue? Est-ce qu'on va voir plus de cas? Alors, parce que ce qu'on voit aujourd'hui, c'est des choses qui sont passées presque 2 semaines avant ceci. Parce que la transmission, l'incubation, c'est 14 jours. Alors, il faut vraiment attendre qu'on soit certaine que les nombres de cas qu'on voit, c'est bas assez. Et aussi, si c'est quelque chose qu'on peut nous assurer que on espère que ça va continuer à être des nombres qui sont très bas. Mais c'est difficile à dire à ce moment-ci.
Merci, Mathieu. Adam Harris, Telegraph Journal.
Thank you. Premier Higgs, I have a yes or no question for you today. Opposition parties in New Brunswick are lining up to say the province's long-term care workers deserve a pay raise amid the stress of the fight against the global pandemic. Should they receive a pay raise, yes or no?
So is this an effort to feed your own story, Adam? The idea of was created yesterday that I didn't have an interest was most ill-founded in the sense of the federal documents that we're now reviewing and the issue that was in Quebec that was workers that were making certainly much less than our workers. If this federal proposal actually we can make this work for our workers, we absolutely want to do it. Because our workers are second to none, and they've demonstrated that through this whole process. So I am certainly very interested to ensure that our workers can not only maintain standards, but be able to receive every possible benefit that is available to them, certainly in the demonstration of the great work they've been doing.
Adam, do you have a follow-up question?
Yes, I do. Prime Minister Trudeau says he's working with the provinces to boost wages for workers who make under that $2,500 mark, specifically those in long-term care facilities. Will you participate if the province has to pay out any part of that top end?
We will participate. In fact, I'm disappointed that the threshold is so low. I am very proud of the fact that the income from our workers here and certainly our full-time workers in our nursing home far exceeds that. And I'm proud to say that. And I'm proud to say that what I've seen in other provinces is really certainly an issue that I don't want to be in the same position here. And so we will continue to ensure that the benefits and the compensation that our workers receive here are certainly second to none, but being certainly fair and equitable and in recognition of the great work that they do. And if we have programs that require participation from the province, we'll certainly look at those because we want to ensure that we're being fair with all the workers.
Thank you, Mr. Harris. Silas Brown, Global TV.
Hi, Premier. I'm hoping you could provide us some details on the legislation that's coming forward on Friday, particularly surrounding the amendment to the EMO Act that would allow for the creation of emergency child care centers. What exactly does that look like? And is that run through education, I think you mentioned, or is that run through
It is.
How exactly is that supposed to operate?
It is through education. We're going to go through the details tonight in our cabinet committee. But the idea is to be able to use our facilities, resources, so that we can actually provide daycare facilities to ensure that all essential workers have that ability in the area of which they're working or the area of which they live. So it's just opening up what would be, let's say, not the normal functionality of our facilities and our resources in the education system, and allowing us just more flexibility.
Thank you. Silas, do you have a follow-up question?
Yeah, is that coming about because there were issues with how the province was trying to run things in terms of getting essential workers their child care? Because I know that the goal was to keep some facilities open for children of essential workers. Were there issues with how that rolled out, and is that why this has become necessary to put in place?
Yes, in some areas it's been very difficult to find child care support for essential workers, and that's the reason it's being rolled out.
Thank you, Mr. Brown. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour le Premier ministre, M. Higgs. Vous avez parlé, M. Higgs, tout à l'heure de 2 projets de loi, dont un pour protéger les travailleurs qui doivent rester à la maison à cause du COVID-19. Pouvez-vous nous donner plus de détails? Est-ce qu'il y aurait des exigences, par exemple, pour les employeurs?
So I'm not sure I got the full understanding of that question.
C'est au sujet du projet de loi, un des projets de loi qui va être présenté pour protéger les travailleurs qui doivent rester à la maison et qui ne peuvent pas travailler à cause de COVID-19.
I guess the important, what we have is our ability, and that was a federal program that allowed people that have to stay home a funding formula for 3 to 4 months. And we certainly supported that with our original gap, and then with the federal program kicking in after that. There's also different programs we're looking at, which I just talked about in terms of the daycare, in relation to having support for essential workers so they are able to go to work and their kids are being looked after in a proper facility, and so they don't have to worry about that, because there's people that are currently able to go to work but don't have appropriate childcare. So I think we're working on both fronts here to assist essential workers.
Thank you. Merci. Michel, as-tu un suivi?
Oui, bien sûr, merci. Monsieur le Premier ministre, vous avez évoqué tout à l'heure le retour à l'Assemblée vendredi et 2 projets de loi, je crois, qui seront présentés. Pourriez-vous nous parler de ces projets de loi, de ce qui sera présenté vendredi à l'Assemblée législative?
Well, currently, the education one, which we spoke of just previously, there was one in terms of furlough. It's given an extension there for longer protection for people that are off on furlough because of the COVID-19 issue, so that they'll have a job to go back to. Also, there's the one where we did have increased fines and penalties, but I mentioned in my address this morning that we were looking at possibly changing that, but I would review that with the Cabinet Committee tonight, and then that decision would be made after that meeting, whether that'll come forward or not.
Merci, M. Corriveau. Colin McPhail, CBC.
Thank you. This question is for the Premier. As you consider reopening some non-essential businesses, you said workplaces will have to follow health guidelines. But I'm curious about the consumer perspective. How do you safely bring consumers back, and how does that play into which businesses reopen?
Well, obviously, it's a major consideration in the factor, but we need and recognize that, and I said this yesterday in terms of as the weather gets warmer and we get into May, people need to have some degree of freedom that is showing, we're kind of on the recovery mode. And that is from anywhere from being able to go back to your workplace because the workplace is meeting the public health requirements, whether more retail facilities can open because they too can meet the public requirements so people can move about more freely. But it's also hinged on where we are over the coming 2 weeks in our numbers. I mean, if our numbers continue the way they are, then we'll be looking to public health to say, okay, what can we do next? And we're working together to decide that. But I think there's a lot of things we will be able to do coming forward, but it depends on the success of the next couple of weeks in terms of our caseload and what we're finding throughout the communities. But it also depends on our ability in the process to follow the guidelines that are currently in place so that we don't see any resurgence, so that we don't, expose anyone unnecessarily. And we do this in a very methodical way. So once we move our way up, we don't find ourselves regressing in, a month or two from now.
Thank you. Colin, do you have a follow-up?
I do, thank you. Again, for the Premier, on similar to the question I just asked, but from the perspective of employees, many business owners are anxious to reopen or scale up or return to some form of normalcy. But what voice will the employees and or unions have in this decision?
So certainly we're anxious. I think everyone's anxious to get back to a normal or a new normal, as we call it. But in the workplace, we have a system today that rules on safety issues. An employee is allowed, for safety reasons, to say, well, I don't feel that my workplace is now safe to work in. And then the WorkSafe will actually do an investigation, and in today's world would look at the public health requirements and see is that workplace able to meet those requirements as an additional concern around safety. So once that is independently determined, if it's determined that the employer is not able to, then the employee has no obligation to come back to work. But if the employer does meet the requirements and is able to provide safe working conditions to meet the regulations, then the employee is required to go back to work.
Thank you, Mr. McPhail. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering if you can repeat in English what you had said to Mathieu Roy-Comeau's question about this idea of this could become new normal for the foreseeable future, and we may never see what we saw prior to this as being normal.
Thank you for that question, Laura. I was actually sitting there thinking about how I answered it, and I actually wanted a chance to answer it again because I think there are some details that weren't completely clear. And so what I said in French was around the fact that, until we get a vaccine 18 to 24 months from now, I don't see things ever going completely back to normal. But what I didn't specify was what are the lists of things on a scale of, what are the things that are most protective at this point, and as you go down that list in terms of what things could happen. So there is actually evidence out there to show that obviously if you have continued risk outside of your jurisdiction, outside the country, that obviously borders would prevent new travel-related cases from coming in. So that would be kind of at the top of that scale. You don't want to have any new travel-related cases. So shutting the borders essentially turns the tap off of that. But that means that whatever cases then remain are either close contacts of those and then the community transmission piece. So the closure of the borders is at the top in terms of what we're trying to prevent from reoccurring. Then the next level down from that would be mass gatherings, and so large groups of people gathering. We would not want that to happen either. So maintaining the, no groups above 10, and make sure you're 6 feet apart, and et cetera. So that would remain. And then as you go down the list, it would include things like bars and restaurants, which have risks, sports activities, which have risks. And then as you get down into the lower things that, again, if you wanted to look at what do you need to do to continue to prevent community transmission, then you would look at non-essential businesses and what social distancing measures each business can implement. But this has to happen concurrently with more mass testing and the continuation of that kind of testing. So as things ramp in different directions, there has to be concurrent pieces of work that go along with that. So in the short term, the medium term, and the long term. And throughout that entire process of looking at which measures to relax and which measures to keep in place, obviously staying below the threshold of what the hospital capacities are able to deal with in terms of hospitalization rates and ICU admission rates, those are pieces of information that will continually play a role in helping us make those decisions. And so throughout this entire time, as we speak about these issues, continuing the social distancing, remaining 6 feet apart, those are things that will continue for a very long time. Wearing a protective mask for yourself to prevent transmission, asymptomatic or pre-symptomatic transmission from yourself to others. So wearing homemade facial coverings, those types of pieces of information will continue. Thorough hand washing, that will continue. Obviously disinfecting areas regularly, that will continue. So there are some things you can see would continue in the longer term, and then the gradation of things that are most protective and have the least amount of risk associated with them, those will be considered as well.
Thank you. Laura, do you have a follow-up?
Yes, thank you for that, Dr. Russell. Premier, I'm wondering if you can speak to the success of Lumen Ultra, the Fredericton-based company that is now kind of been thrust on the national stage because of what they're doing to help clear across the country with the chemicals in the testing kits.
Laura, I can't speak with any degree of, accuracy in relation to just reading about this and understanding that they're able to provide the reagent in a very timely need, but to the capability that they are going to provide this and throughout the country, I think is rather certainly encouraging, but also maybe very symptomatic of what other capabilities may be hidden throughout our province, that others can come forward and do the similar things in other areas. So I just commend them. I think this is an example of New Brunswick innovation and New Brunswick companies coming forward and be heard and seen across the country and the influence they can have nationally.
Thank you, Laura.
Voilà la fin de notre mise à jour. Merci beaucoup. That concludes